When it comes to health crisis, the most critical challenges for our countries involve the ripple effects across our interconnected infrastructures. A pandemic doesn't just hit hospitals. It disrupts everything, from transportation to emergency services, leading to shortages and economic downturns.
One of the biggest issues is concise and timely communications. When we get into what would be deemed a crisis, or whether it's caused by climate change, health, or cyber attacks, the public has to be confident that its leaders are giving them consistent messaging. And when it comes to that messaging, it can't be changed very frequently. So, and that's what causes confusion. And confusion can cause panic. And, I think as legislators, we need to instill confidence in the public that we represent.
What happened was we received a lot of money from the federal government to the states to be able to strengthen our healthcare systems during the pandemic. But over the course of the last 2 years, what's ended up happening is hospitals went from making epic profits to now barely breaking even. And so they're not reinvesting in the system, they're not buying new equipment, they're not giving nurses pay increases.
Going forward, we've learned many lessons, and one of the first things that we've done is that we need to have legislative ways of dealing with an emergency response. And so we have now legislative measures that give extra powers to the people that need to have jurisdiction over healthcare, such as our Chief Medical Officer of Health. We also ensured that we have an abundance of personal protective equipment, because when the pandemic hit back in 2019, we realized that all of our stockpiles of gowns, of gloves, of masks were actually expired.
Public education is crucial. By empowering people with knowledge about infection control and first aid, we can build a more resilient society, ready to face future health emergencies.